Tóth Csaba vagyok.
I am Csaba Tóth. I work as a doctor in internal medicine. My main role is treating chronic illnesses, such as diabetes. I graduated as a doctor from university. I worked as a doctor providing emergency medical care. I started working in internal medicine later. I've been a nutritionist for 6 years. Initially, we've been using the paleo diet. Then, after collecting enough feedback and experience, we switched to the paleolithic ketogenic diet. We've been using it for 3 years, mainly to treat high blood pressure, diabetes, autoimmune diseases and cancer. We started using the paleo diet, but the results weren't perfect. It's good for treating high blood sugar levels and high blood pressure, but it's not effective for autoimmune diseases, such as Crohn's disease. So we started using the paleolithic ketogenic diet, which combines the advantages of the paleo and the classical ketogenic diet, while overcoming the shortcomings of both diets, resulting in a very effective diet that can help patients. It's very simple. Our psychological and physiological needs are different. We like to eat hearty foods, carbohydrates, milk, bread, cakes, and we think that these are natural parts of our diet. Quite the contrary. As biological creatures, we are predisposed to eat meats and fats. A mismatch between our genetic predisposition and our current diet is giving rise to the increase in diabetes and other chronic illnesses. Well, the concept of the paleo diet is that humans were eating healthily in the Paleolithic age. The classic ketogenic diet has several components that are forbidden in the paleo diet. Vegetable, plant oil, seed flour, sweetener and dairy products. It is because of the exclusion of such foods that the Paleolithic ketogenic diet is much more effective than the classic ketogenic diet.
Ezeknek a kívánalmaknak, ilyen a növényi olajak, ilyen a különböző maglisztek. Az alacsony szénhidrát tartalmú étrend.
Low carbohydrate diets have serious advantages compared to high carb diets, but it's not a full solution. I think the ultimate healthy diet is the Paleolithic ketogenic diet, because it entirely suits our biological needs. The more we conform to our biological needs, the more effective a diet is. If someone is already following a low-carb diet, the paleo-keto diet is an easy switch. The classic ketogenic diet has disadvantages, like the ones caused by plant oils and the dairy products. These could result in developing health conditions later on. Very fast results. Ketosis develops within a few days, and so the first results are also seen very early. The first advantage is the amount of energy. We can get up to 3 times more energy from the Paleolithic ketogenic diet. What's more, the symptoms of illnesses like high blood pressure and high blood glucose can simply vanish after a few weeks. It can help the symptoms of the autoimmune diseases too, and with time there is a possibility to recover the autoimmune diseases themselves. Intestinal permeability and permeability of other membranes play a huge role in the development of autoimmune diseases. Currently, we do not know any other diet or method which would be able to normalise the barrier function of these membranes.
Ugye az egyes típusú cukorbetegség tulajdonképpeni lényege.
We talk about type 1 diabetes when the pancreas can't produce enough insulin on its own due to the autoimmune destruction of the beta cells. The Paleolithic ketogenic diet can stop the autoimmune process in diabetes. It can halt the decay of insulin production. What's more, it can even improve the insulin production once highly adhered to the diet. There are several instances where a patient had a healthy, insulin-free life with this diet. It's working as well. The complications are avoidable as well. What's different is that it's always working. With a Paleolithic ketogenic diet, it is possible to restore normal functioning of the body. It doesn't matter how long the patient has been a diabetic or what their blood sugar levels are. There are no side effects. We check our patients regularly, but we've yet to experience any side effects. Like I said before, this is the best diet for humans from a biological point of view. In my experience, the ketosis appears after a few days of the diet. This can have side effects, mainly from the sudden high protein intake, such as headache, diarrhea. These disappear after a few weeks. Then the body gets entirely accustomed to this type of diet. There may not be a complete normalisation of the intestinal permeability during the initial period, but tissue starts to regenerate, so it helps patients with Crohn's disease, dermatitis or eczema. It's important to consider how much protein we eat. It's not necessary for the human body to consume a lot of protein. What's important is the fat. We get our energy from fat. Without fat intake, this process can't work to its fullest. But it's important to consider that fats of plant origin are never healthy in the long run. Our feeling of hunger also changes. In a carbohydrate-based diet, the blood sugar levels are the main influence on our hunger. But in the case of the Paleolithic ketogenic diet, the energy levels are the influence of our hunger. It's recommended to eat twice a day on the Paleolithic ketogenic diet. The general need for food decreases. Our bodies produce energy from the fat, and during this process water is also produced. The same goes for water intake. You need less water with a Paleolithic ketogenic diet than with a high carbohydrate diet. It's also important to mention that eating offal, such as bone marrow, liver and kidney, is essential to maintain healthy vitamin levels.
Szkeptikusan egyrészt, másrészt érezhető távolságtartással.
They are skeptical and very distant. The main reason for this is that stating that someone with diabetes can have a long life without insulin and that this disease may be reversed goes against today's medicine. But mostly, they don't even know about this opportunity. If a patient with type 1 diabetes wants to use the Paleolithic ketogenic diet and seeks help from a diabetologist, they will be refused because the diabetologist doesn't know whether and how the diet works. However, I think this will become more widespread in the near future. The other important factor for this skepticism is the philosophy behind it. If we can't cure something with expensive clinical treatments, however could we cure it with simple diet?
Annál inkább nyilvánvaló lesz, hogy ez egy rendkívül komoly lehetőség az egyes típusú cukorbetegségnek a kezelésére. We have to go back to previous methods. This means we can't just figure out a cure for a disease. We have to go backwards. We have to see what works and how well it works in practice. We can't deny the Paleolithic ketogenic diet, and we can't deny any scientific fact. I tell other healthcare professionals to get experience with patients regarding this diet, help these patients, and if the results are good, we have to support this diet.
És aztán ebből lehet levonni következtetéseket. Hát ez azért nehéz kérdés, mert teljesen egyértelmű.
It's a hard question.
Krónbeteg akár ötször is neki futhat, akár.
A person with Crohn's disease can try the Paleolithic ketogenic diet, or other therapies, many times. But for people with new onset type 1 diabetes, there's only one chance to restore insulin production. Thus, it is important to intervene with the diet as early as possible to keep the insulin production, because later on, there will be no second chance once the autoimmune process has destroyed the beta cells. It's definitely worth a try for a child with type 1 diabetes. If someone's been using insulin for years, it's not true that blood sugar level fluctuation leads to complications. Actually, these complications are unrelated to the blood glucose, but are caused by the inflammation. There are several kinds of inflammatory diseases other than diabetes, such as kidney failure and heart attack. This also supports the theory that it is inflammation and not high blood sugar that leads to complications. So if a person with diabetes starts the Paleolithic ketogenic diet, even if they have to take insulin regularly, there's a chance that the complications can be avoided in the long run. Yes, we use it for autoimmune diseases and cancer with good results. For example, Crohn's disease can be reversed and patients with cancer benefit greatly from the diet. In some cases, it's possible to stop the cancer growth even without surgery. We can stabilise the patient for a very long time. Also, there have been times when patients were cured of cancer with surgery and the Paleolithic ketogenic diet. They can lead a full life, symptom-free.
Hát alapvetően kell azt látnunk, amit már szintén említettem, hogy
We have to keep in mind that our biological and psychological needs have diverged from each other.
A pszichés szükségletünk teljes mértékben felülírja a biológiai szükségletünket.
Motivation is needed to stick to the diet. But if a child who is suffering with, for example, advanced Crohn's disease, tries this diet, they won't feel that the diet is restrictive, but they will feel that they are getting better. The support of the family and the environment is also a very important factor. With a supportive family, it is much easier to follow the diet in the long term. My personal opinion is that this is not a restrictive diet, but a very healthy diet. If we want to do something, health is the most important thing to maintain. If the patient uses this diet, then no. We don't know of any cases where a patient didn't have positive results with this diet. Yes, we have lots of patients like these. It is important to see that the Paleolithic ketogenic diet is a complete opposite of the vegetarian diet. It takes a lot of willpower because these patients have to switch to a completely different diet. What's more, they usually have strong opinions about their diets. But the vegetarian diet is devastating on health, so the only way to recover and lead a healthy life is to use the Paleolithic ketogenic diet.
Ez egy nagyon érdekes kérdés, és érdekes válaszok születhetnek.
This is a very interesting question. I mentioned before that the amount we have to eat is about a third of what we do eat. This means that we would have to buy 3 times less than we would otherwise buy, and that we have to produce 3 times less food than we would otherwise produce. This means there's less packaging if we don't buy processed foods and we buy less medicine. For example, let's say that a person spends a lot of money buying 10 types of medicine every month. With a paleolithic ketogenic diet, this person no longer needs these medicines. So the pharmaceutical industry, which is responsible for a lot of environmental damage, has to produce less medicine. The third aspect of this is that livestock farming is no worse in an ecological point of view than cultivating plants. For example, the greenhouse gases and the ammonia are not as bad for the environment as we think they are. The other very important aspect is that cultivating plants requires large amounts of pesticides, for example because we want to grow cereals where it is not possible. The soil is damaged already, and these chemicals can impact our health in a very negative way. In livestock farming, there is no need for pesticides and chemicals.
Megint csak alapvetően egy érdekes momentum az pedig az,
Yes, absolutely. We know that Inuits and Eskimos are healthy as long as they don't purchase food in supermarkets and follow their own diet. We know that these people basically have a Paleolithic ketogenic diet, and researchers didn't find any health complications, only benefits. It has been raised that these Arctic people have lower life expectancy, but this is because they don't have access to healthcare, and infant mortality is high. It's also not true that they die early. What's true is that many of them die before reaching adulthood due to injuries, but this had nothing to do with diet. I'm skeptical, and at the same time, I think this is the only solution for humanity. If someone really wants to get better, there's no other option. Of course, we started to grow organs, so organ transplantations will be more significant in the future. But the brain cannot be transplanted, so I think there's no other option to be healthy. We can't change evolution. However, there are other problems. The fact that there is already 7 billion people on the planet, how can all of us follow the paleo-keto diet? If someone really wants to get better, there's no other option. This is my experience in the view of the past 8 to 10 years of medicine.